Yes, thank you very much. Uh, Before I begin, I have to say that I'm not Professor Dr. Nazmul Islam. I'm Dr. Anindar Homan. I'm Program Manager for Diarrhea Control Program in Bangladesh. I'm presenting this presentation on behalf of Professor Dr. Nazmul Islam because he is sick with a viral fever and has a severe sore throat, so he cannot present. Please, next slide. So this year we have, I think we have lots of things to update. We have done lots of things on diarrhea control and also on cholera, because there's some events that happened and we have done some things. So I'll be very brief, but this year we have had a very severe outbreak of diarrhea, especially in Dhaka, which is the capital of Bangladesh. And this outbreak was a bit unusual because it started early in March, which is normally starts in April, the normal peak, but it started 1 month early, and it was a bit higher than previous years. Especially 20 and 21, we had so number of less cases, but this year we had about 1,300, 1,400 cases every day. But obviously not all of them are cholera, but about 30 to 40% of them was cholera. So we had lots of meetings on our core working group and stakeholder meetings. As we already know that we have a national cholera control plan since 2019. And according to that plan, we have some working groups and technical groups. We had meetings on those, not only due to the outbreak, but also because we did some preventive things in advance. And because of the outbreak, we have started a reactive OCV campaign, which is now ongoing from 26 June. And this is another reason why we could not join this program physically, because we are busy with the campaign and also some other activities. Anyway, thanks to the Intersectoral Coordination Group for providing the vaccine and also the fund through Gavi. And this is very much welcome. And we already in last 3 days, including today, we have seen lots of demand for this vaccine, and we are this campaign is going very smoothly. We'll provide the report later. And you will be happy to know that our Honorable Minister of Health himself inaugurated this campaign. So you can see that cholera has we are prioritizing given some priority by our stakeholders and our authorities. Next slide, please. Next slide, please. Yeah, thank you. So just a graph to show you that the number of cases was very high in this year from March. Next slide, please. And this is for it to show that the usual number of cases in coming from our cholera surveillance, which is around 13%, 12%. Next slide, please. Regarding some other activities, our WASH situation, we have done quite a few advocacy activities to improve our WASH, but still a lot has to be done in the WASH sector. In this campaign, we are also trying to provide some leaflets and miking, do some miking to improve our WASH. And we have done some meetings with the Water Sanitation Authority, City Corporation to improve WASH. But as I mentioned, we still have a long way to go. But we already have approved our national WASH strategy and WASH strategy for healthcare facilities, and we are trying to implement that right now. Next slide, please. We have done quite a few capacity building activities. This year, we have trained more than 1,000 doctors and nurses in diarrhea management, specifically cholera management, because cholera management, we are trying to uniform the management all over the country and also trying to reduce the antibiotic uses. So we have developed a national guideline for diarrhea management, and this has been distributed, and also training has been done. And as I already mentioned, we are doing some advocacy. So we have done, we have 8 divisions in our country, and we have done advocacy meeting in 5 divisions, comprising all the health authorities in those divisions, hospital directors, local health administrators, civil surgeons, all of those came, and we are talking about how to improve our management of cholera. And we have bought lots of intravenous saline, ORS, and water purifying tablet for these activities as well. And as you already know that through this country support platform is now active in Bangladesh through IFRC. We are working together. Next slide, please. This is just some photos of our activities. So we have done this year: training, advocacy meeting, and our OCB campaign. Next slide. Yes, you can see our Honorable Health Minister inaugurating the vaccine campaign in Dhaka. And I think more than 40 newspapers have reported on this, and more than 30 TV channel has reported on this. So you can see that it has been prioritized in our country. Next slide. So our priorities, this is my last slide, I guess. This is our priorities for 2023 and the rest of this year. We are trying to improve our coordination mechanism among the stakeholders, and I think IFRC will help us in that, because as you know, diarrhea control is a very multi-stakeholder team. We alone cannot do that. So we're trying to improve our coordination mechanism. And obviously we will have to finish the first dose campaign and then prepare for the second dose of the campaign. And this will be very important, because if we can show a good result, then we can ask for some other activities. We can ask for more fund from the authority. So this is a very important campaign for us. And we are trying to improve our wash situation. We are already bought lots of RDT kit for cholera. So we are trying to, we are already procured, but we still not received all the kits. So whenever we'll receive the kits, we'll distribute them into our primary, secondary facilities. And I hope that cholera diagnosis will very much improve by this. We already mentioned that we have provided lots of capacity development for this according to our guidelines. And we are trying to establish early warning response system as well. And we're trying to strengthen our surveillance system. I think I'm finished with my slides. But we have a lot more to say, but I was told that I have to be very brief. So it is my very brief presentation. Any question I can answer. Thank you.